Worried about coronavirus? This message is for you. If you're watching this, I'm sure that you, like me, are concerned about exposure to COVID-19. I'm Dr. Greg Carter, and I want you to know you're not alone. Our team of doctors, nurses, and providers is here for you. COVID-19 is a new or novel coronavirus that has not been previously identified, and the virus causing coronavirus disease, COVID-19, is not the same as coronaviruses in the past, commonly circulating among humans and causing mild diseases like the common cold. Patients with a diagnosis of COVID-19 must be evaluated and cared for differently than patients with a common coronavirus diagnosis. The name of this new disease is Coronavirus Disease 2019, abbreviated as COVID-19, where CO stands for corona, V for virus, and D for disease. The 19 simply designates the year of its identification, 2019. It turns out there are many types of human coronaviruses, including some that commonly cause mild upper respiratory tract infection. COVID-19 is a new disease caused by a new coronavirus that has not previously been seen in humans. Coronaviruses are a large family of viruses. Some cause illnesses in people, while others typically infect animals. In some cases, animal coronaviruses have emerged to infect people and can spread between people. This is suspected to have happened for the virus COVID-19 that causes coronavirus disease. In fact, MERS and SARS are two other examples of coronaviruses that originated from animals and then spread to people. The first infections are linked to live animal markets, but the virus is now spreading from person to person. It's important to note that person-to-person spread happens on a continuum. Some viruses are highly contagious. The virus COVID-19 causing coronavirus disease seems to be spreading easily and sustainably throughout communities in those affected geographic areas. Now, community spread literally means people have been infected with the virus in an area just like yours. So COVID-19 seems to be unlike anything we've seen before, and it's important to take this seriously. COVID-19 appears many times more deadly than a common flu. It can be present in your body, and a person can be contagious without symptoms for weeks, and it appears to do significant damage to your lungs and respiratory system when not caught early enough. Your providers need to evaluate you and your symptoms, and in so doing, identify exactly what pathogen you have and its stage of progression, because early onset symptoms of different pathogens can be similar, but treatment of coronavirus is very different. We don't want to waste days or weeks guessing or treating for something you don't have, while conditions are getting worse simply because we didn't have the right information. We now have a new weapon to identify if you have COVID-19 or one of 24 other viruses and respiratory damaging pathogens. This is an advanced molecular respiratory pathogen test known as RPP. RPP results are available within 24 hours and can help your provider know exactly what you have and how to best treat it. RPP is the new gold standard in respiratory infectious disease testing and is available for you today. It's true, the government has stated the coronavirus part of the test will be covered completely by insurance. The RPP testing of the other 24 pathogens is still subject to copays and deductibles. We've made the process of getting the complete test easy by eliminating any financial uncertainty or responsibility for the complete RPP test by offering you a $99 copay and deductible waiver so that you will not be responsible for any out-of-pocket costs for your RPP. We'll then set you up with a doctor who can see you quickly, perform the test, get the results within 24 hours so that you can get needed treatment immediately. Time is of the essence. Call now so we can set you up to get your test now. We're here to help.